All right, I am really excited to welcome tonight our speaker. So, funny story, we quoted Dr. Ross on our podcast, Okay, But Why? And then one of my colleagues, Missy McGinnis, said, Oh my gosh, I know her. We are friends from college, I think you said. And so we were able to get in touch with her and have her come on to share her expertise. So I love the small world that we have here. People know each other. So, Dr. Mathilde Ross, MD, is a senior staff psychiatrist at Boston University Student Health Services. Her essays on mental health and parenting have been published in the New York Times, the Boston Globe, and CNBC. She is also a TED speaker and has appeared on Emily Oster's Parent Data podcast. She has an upcoming book, which we're going to share with you in just a little bit, called How to Thrive in College, and it's expected to be published in early 2026. So I'm going to bring her up here, and I confirm that we're going to call her Tildy. That is the name she prefers. So we're happy to have you here, Tildy. Can you just start off by telling us a little bit about your practice and your area of expertise?
Sure. First of all, thanks for the invitation. I am really delighted to talk about this project, and I'm so excited about your organization. So I'll tell you about my background. Some of the terminology in mental health gets a little bit confusing, so I'm just going to assume no prior knowledge. So I'm a psychiatrist, so that means I have an MD and then did a 4-year residency training program after medical school. From there, I worked at Cambridge Hospital for 5 years, which is a Harvard Medical School teaching affiliate. And since 2008, I've been at Boston University in their Student Health Center, and it's been a clinical role taking care of mostly college students, some graduate students. Um, uh, and I think that about covers that. Yeah.
Okay. Can you give us a basic framework for understanding the major drivers of mental health problems in young people?
Sure. So I think this is a great place to start. And this answer is going to be on the long side, but I think it's going to be worth it because I want to give sort of a frame. And then some of the other answers are going to follow logically from the way I lay this out. So since I work at a college, let's pretend you're taking your final exam in my class. And the exam question is describe the most important drivers of mental health problems in young people. So if you write about poverty and all of the many ways that poverty is terrible for mental health, if that's the only thing you write about, you're getting a 70. So you are going to solidly pass my class. I'm going to be like, this individual understands that to understand mental health, you've got to understand poverty. So if you add to that a decent discussion of trauma, you're going to get yourself all the way to an 85. So trauma is not like, oh, my friends got a cell phone a year before I did. No, trauma is growing up in an environment where your basic safety cannot be taken for granted. It's terrible for development, which means it's terrible for mental health. So if what you leave with today is knowing that the big story in mental health is poverty and trauma, I will consider my job done for the evening. You will get an 85 in my class, with which last I checked is like a decent grade. And you really will understand the big picture. Now, add a couple more things, and we're going to get you all the way to an A minus. And this is sleep deprivation, which goes with caffeine. I'm going to come back to this one later because it's really important. I'm aware that I don't need to tell a bunch of moms that sleep is really important for mental health. But sleep and caffeine, I spend about a third of my clinical time talking about that. Throw in marijuana. We're going to spend more time on this one. Punchline is marijuana destigmatization has been a disaster for young people. I also spend about a third of my time working with people to get them to use less marijuana. So if you understand 4 things, poverty, trauma, sleep, and marijuana, you have got the big picture, you can honestly come and do my job most days. Now, everything else, so you've got your A minus, great. Everything else is just that last little bit. So all the stuff you hear about in the media, genetic testing, genes, every other thing that you hear about is important for psychiatrists to know and other mental health professionals, but you don't really need to worry about it that much when you're thinking about the big picture. So that's kind of where I want us to start. And so as questions come up, I'm going to sort of attach them to this tree and be like, yeah, this is part of like the fundamentals that you've got to understand versus, this is something that's like pretty interesting and people like to pontificate about, but probably is missing the big story. So that's where I'd like us to start. And sorry, that one was on the long side.
No, like that's a good framework. Honestly, you're giving me a little bit of cold sweats thinking about taking an exam again. So I feel very far removed from that. But it was a very good framework to understand that. So I mean, obviously, we have seen growing concern over mental health of children over the past several years. Can't really turn on the news, I feel like, without hearing a story about that or reading an article in a magazine. From your perspective, is this a crisis? And if so, like what's behind it?
Um, right. So the idea that there is a growing mental health crisis has like taken hold in the media really strongly. So I guess one place to start is that like any avoidable mental health crisis in a young person is too many. So if we want to use the word crisis, fine. So the question about whether it's going up is not talked about super clearly in the media. There are a couple of things that people should know. So a couple things happened around 2012. One is there's a diagnostic manual um, uh, called the DSM that is used for sort of, so we have sort of an agreed upon nomenclature for describing various mental health conditions. It gets updated every 5 years or so. And around 2012, maybe 2013, the DSM-5 came out. And when the DSM-5 came out, a lot of diagnostic categories got squishier and it became easier to give people diagnoses. Also around the same time, you had the Affordable Care Act, which you guys all probably understand better than I do, but it brought lots of things. But one of the things that brought is a whole lot more mental health parity in health insurance coverage. So a lot of mental health things that weren't previously required to be covered were required to be covered. So more people were able to get mental health treatment using their insurance. And when you do that, you get a diagnosis. So for sure, diagnoses went up starting in around 2012, 2013. Whether that was capturing a worsening of mental health is, a little bit unclear. I think this is going to sort of tie into where we're going in the next question. But, one way I think about this is I've heard so many people say like, well, are mental health crises in kids going up? And if so, what's the reason? And one of my reactions to that is like, well, what if we just take a step back and say, well, why are there so many mental health problems in kids in the first place? And maybe we should focus on that instead of quibbling over, are we having a rise of a couple of percentage points or something like that? And I think that's going to loop back to what you want to get to next.
Okay, no, that's for sure. And I think this goes to that framework you've laid out, but like, you obviously read research and then you hear stories directly from families, from patients. So what stands out to you as the biggest changes in what kids are facing today compared to like even a decade ago?
Yeah. So it is a disgrace, the number of kids who are growing up in poverty in this country. It just is. Poverty is no child's fault. And it is getting worse. Obviously, the financial crisis in 2008 got tons of attention for uh, quite a long time, but there's been a steady drip of various factors that have been very hard on family life. Cost of housing has gone up. There are more and more families living close to the edge. The opiate epidemic is like the hurricane that has never stopped and has devastated tens to hundreds of thousands of families in this country. So we're thinking about the big things. We're thinking about poverty. We're thinking about trauma. Those things have been raging. I think it would be surprising if mental health problems in young people were not going up. I also want to go back to the two things that I said I was going to come back to. And these are kind of seem like small things, but where I work turn out to be big things. So getting back to marijuana for a second. This is one of these areas where the reasonable middle is kind of drowned out by both sides. And so, yes, I think locking kids up for small amounts of marijuana possession is ridiculous. But also unfettered access all the time is equally ridiculous. Where I live, there are billboards. You can get marijuana delivered to your door. I think it's any time of day. And of course, the billboards are up in the parts of the city where young people live, many of them students. Weirdly, marijuana is probably not all that bad for people over 25 in moderation, but it is quite devastating for the developing brain. Psychotic disorders are the extreme end. Fortunately, that is rare. But tons of anxiety disorders, depression, and various problems related to suboptimal functioning and not achieving potential. This is huge. It is really widespread. It is a massive change since I was in college. And it's even a change since my early years at BU. In my early years, before the sort of wave of marijuana legalization and destigmatization, it was much more rare to see anyone running into trouble with it. The other one is just a little bit funny, only you wouldn't believe how many emergencies are caused by it. Sleep deprivation and caffeine. I am talking about energy drinks mostly. Well, actually coffee too. If you have, I have kids in high school, so I've done a lot of college tours myself lately. Every single college campus, they brag about their coffee shops on every corner. They are branded coffee shops that you've heard of. 24/7. The energy drinks are everywhere. I think the first one I even knew about came out in, I don't know, around 2000. The first one I knew about was Red Bull. There's like a dozen brands now. I found out about one this week that's like the feminist energy drink. I was like, what is happening? So these things have twice as much caffeine as coffee. And kids are drinking a lot of them. They taste like Jolly Ranchers. Um, Kids at the high school in my town, kids will like in the middle of the day go to CVS and get a couple of them. Kids are not sleeping enough. The impact of sleep deprivation on the developing brain is, it is totally reversible. These kids get better, but it makes it look like they have anxiety disorders or sleep disorders or ADHD. And it is a huge reason that people come to our office.
I'm just curious because as a parent, I mean, when I grew up, there were no energy drinks. We didn't have Starbucks on every corner. I remember thinking it was really cool to try to drink international coffee in my dorm. I hate coffee, by the way. So, but so the energy drinks and the coffee, is it just what is it doing to their brains, I guess? And I'm wondering why we're not hearing more about this. Like I personally haven't heard a whole bunch about
Yeah.
the impact on developing brains.
Well, so, coffee, it's probably not impacting development. You do hear the stories occasionally. I think it's Panera that has like a lemonade that has a crazy amount of caffeine. And there were some cardiac events related to people drinking it, not realizing how much caffeine it had. Um, so it's like speed. It's like if you have a cup of coffee that you drink over an hour with your breakfast, your caffeine blood level is going to go up and you're going to be maybe a little jittery if you have too much, or, you're going to be more alert, which is probably why you have it. But if you do it, so these energy drinks are meant to be taken in like shots. So people really down it. So the blood level spikes. They make kids, well, they cause a lot of emergency room visits. For a common one would be panic attacks. So someone who's like maybe a tiny bit susceptible to a panic attack is going to be thrown into a panic attack by one of these things. And then chronic use is associated with just like not sleeping enough, which leads to like them not being able to pay attention and them being irritable and snapping at you. Um, and It is sort of a sleeper cause of a lot of stuff that young people struggle with. Pretty common for kids like this to come in thinking they have ADHD or an anxiety disorder. And often just cutting caffeine out of their life just like makes them better.
So I'm kind of curious then, because you talked about poverty and trauma, which obviously is not in their control, where how much you take too much, caffeine or, decide to purchase marijuana, that is a little more in your control. So how much are you seeing in terms of external stress, things that are happening in the world, um, or is it versus like internal factors? Like how, I guess like how much of it is outside factors that they can't control, the world's impacted them versus maybe internal things. And then there's also the stereotype of like, well, they just need to learn how to cope with it, or they need to figure out how to, you know, regulate their own emotions. Like I hope I made that wasn't a clear question, but hopefully you know what I'm talking where I'm getting at.
Yeah, yeah, no, perfect. So um So one of the reasons I mentioned in my office that I spend a lot of time talking to kids about the things that they're putting into their body. So, you know, the things that are within one's power to control are good things to focus on because you can make a lot of change. And things, and one part of the context for young people and kids growing up is there are so many things outside of their control. And the things that you can sort of give them ownership can make a really big difference. Um, the Dealing with adversity is like part of what humans do, and it's one of the tasks of development is to learn to deal with a little bit of adversity, and that is definitely part of the role of parents and other adults in their world is to help them with that. Um, but to a very significant degree, you know, development wants to happen if things aren't getting in the way. So if the circumstances are right, the normal maturational process is something that really wants to happen. So yes, helping kids manage the things that are going on in the world, and also sort of knowing when to shield them from things going on in the world. I personally don't think it's super useful for kids under 11 or 12, like elementary school age. I don't think it's super useful for them to know all of the terrible things that that happen every day. They need to have a sense of safety so that they can explore and feel like they are going to be okay. I think I kind of meandered away from your question a little bit, but I hope I got sort
No,
of
no,
the
I think that's okay.
core.
And I think I do want to touch on, and you kind of leaning into this, and it's not completely following our question order here, but so one of the things, of course, kids nowadays, and this is what I think the media talks about ad nauseum, is social media, social media, social media. And so you have an 11, 12-year-old, they're on social media. So they're seeing things like political violence in the world. They're seeing gun violence in school. They're seeing, wars. So I am really curious about, like, if you can address the social media aspect of this. Obviously, limiting that for children who are young is understandable. The older kids are going to hear about those things in the world. So, um, as a parent, you do have to kind of help manage that. But I would also just love to know, like, what you think about what the media gets wrong when they're talking about this, and how it does social media impact kids' mental health right now.
Yeah, okay. So I think this is like a few different questions.
Probably.
Um, and so I want to make a comment about the media in general, if that's okay. So because I think the media is getting a lot wrong about mental health. And the news media in general likes to focus on what's new, and what's controversial. No big name newspaper wants to run a story that it's like, these are well-established principles of mental health that everyone in the profession agrees on. It's just not a story. They like to write about what's new, what's hot, and what people are arguing about. So, you know, so that is sort of my big picture. So social media is a lot of different things. I actually, so the political stuff is like awful. Um, and there is a lot of unpleasantness there, including a lot of just like harassment and bullying and all of that stuff. Um, what I see in teenagers, they honestly mostly use it to communicate with their friends. Um, and I think social media, when it is a mode of communication with people who are also people that you know in the real world, can really be a totally okay part of growing up. Um, I'm going to say a little bit about like my level, like the number of young people that I've worked with. And, it's like around 3,400 college students that I've worked with at this point. So 17 years at BU, around 200 students a year where I'm involved in their care. Um, Multiply that all together, you get around 3,400 students. It is a tiny number of young people where I think social media has been a serious problem for them. It's not zero, but it is less than a few dozen. So, so when I built my like 70%, 85%, so social media, it's there. Some people are getting into trouble with it. But it is a pretty tiny number. And there are many, many who are using it in ways that seem fine to me. Now, do they need reasonable limits? Sure, like everything in moderation, right? Um, and they need to learn to have it off at night and go to bed at a reasonable hour. And, if it's disrupting family life, maybe there's a consequence. For sure, limits on it are appropriate. But I am mostly not panicked about social media the way teenagers are using it. I actually think the way adults are using it is like far worse, as far as I can tell. But I'm actually also not on social media. So most of my knowledge of it is through my own kids, and through my work. I am completely aware that there are many people out there who totally disagree, which is why I sort of couch this as this is where I'm coming from based on this particular set of experiences. Um, it is not the thing that keeps me up at night.
Okay. Um, is there anything else that you see portrayed in the media that you think is harmful, or just like kind of bordering on misinformation that is confusing to parents and caretakers?
Yeah. So actually, so this is the funny thing. So most of the information that I see like in reputable newspapers is perfectly fine information. It's just without context. So there might be a big story about, for example, genetic testing. And it's like, okay, well, that's interesting. That's relevant to about 1 in 10,000 people. So like, so something like that, it's just like not super helpful when the context isn't presented. Um, but one thing I'm going to say about the way mental health is talked about in the media in general and social media in particular. Um, so everybody has emotions. So emotion is a totally normal part of life. But most people will never be at risk of a mental health problem. And on social media, like it's like trendy to talk about your emotions like they're mental health problems. You know, it's like normal to be anxious before the bar exam. That doesn't mean you have hashtag anxiety, whatever. So I think it's super confusing for people. It makes it look like mental health problems are more common than they are. And I actually think it undermines people who genuinely have mental health problems to see people going on about all of this stuff that they don't know anything about and um, but still like, able to live their life totally normal without their symptoms interfering because it's just emotions. So that's something that is like unnecessarily confusing. And you know, it's not going to get any better, but so social media is that way about any number of topics. So, but yeah.
So what would you say to, I think parents, because I think sometimes there is a misunderstanding around mental health issues, because I've definitely heard, especially like, I don't want to stereotype guys, but my own husband, things like, oh, they're too sensitive, or they're just lacking resilience. So what do you think it is that like parents also misunderstand about mental health when it comes to like caring and getting the assistance their own kids need?
Yeah. Um, so so their kids that have true mental health problems who their parents for one reason or another don't want to bring them. Let's not talk about that. I'm reading this question as like, should we be pushing them a little bit harder and make them suck it up and be a little bit more like we had to be? So um a couple of things on this point. So if you haven't faced any adversity, it's going to be tough when you do. Um, but humans are super resilient. So when you start hitting adversity, you're going to be able to handle it. If you had to live in a world where kids face too little adversity and therefore have to do some catching up when they're teenagers or young adults, that is like such a better world than a world where kids are like pushed too hard to where they are damaged. Um, it's super hard as a parent to know like when to push them and when to just scoop them up and say, yeah, not today. It is super hard. Um, and the reality is if they are developmentally normal and they haven't hit very much adversity by the time they're 11 or 12, teenage years are going to be a little harder, but someone's going to break up with them or say something mean behind their back and they're going to cry and they're going to develop that somewhat thicker skin. If a child is traumatized early on, they are set back in so many ways for their entire life. Obviously, there's treatment, things can get better. It's not quite as simple as that. But if you're going to make a mistake of being too soft on a kid versus being too hard on the kid, I think it's fine to be too soft. Having said that, we haven't gotten to college pressure yet. And I talk about college pressure a lot in my book. So college pressure, it's not your imagination. It is way worse. When I was in high school, I went to a pretty good high school, and pretty much like junior year of high school, 11th grade, people started worrying a lot about college, doing extra activities, you know, begging their teacher for an A if they got an A minus, all of that stuff. That has been pushed back to like ninth grade, maybe seventh grade. There is so much pressure on kids to be perfect in school. Um, in the town where I live, like ninth graders believe that if they don't get straight A's in everything from the first day of ninth grade, they're not going to get into a certain subset of colleges. And they're not wrong. Um, so um, we have created a totally unhealthy environment for teenagers. Um, Talking about college-bound teenagers here mostly, is that's who I deal with. Um, Many kids get through it just fine. Again, kids are naturally resilient, development wants to happen, people want to grow up. But we have sort of created an environment where any degree of failure is unacceptable. And teenagers need failure. Failure is how you develop. It's how you learn what you're interested in, by the way, to like try stuff and be like, ooh, that wasn't for me. Or ooh, that went well. You have tons of kids who by ninth grade are like scared to do something new because they're not going to be good. And it's when I was a kid, I was bad at tons of stuff. Oh my God, I played the piano for like 8 years. I was terrible. I'm sure anyone who heard me practicing like wanted to cry or leave the house. But when I was a kid, you just did stuff that you were bad at just because you did. And everyone did a sport at my school, even if you weren't good. And you did it for fun. And all of those things that people my age did for fun are now almost always a competition. Almost always like have a college track component to it. Um, and It's not healthy for them. I go a little deeper into it in my book because it's actually, I think, worse than I have just laid out here. Um, but yeah, I mean, I think if you wanted to design a college application process and optimize it for bad mental health outcomes, you would create pretty much what we have.
How do
Um,
parents? I'm just curious because in my community, 100%, like we actually got rid of valedictorian because number one, it was like 0.00003 difference, and then number two, kids were hacking into the computer to see where their standing was in the school. The pressure was insane. So I'm curious as a parent, like in that environment, it's there, it's created. Like, how do we as parents, you know, approach that with our children to try to minimize those pressures on that mental health?
yeah, I gotta say, this is so hard. And one of the reasons that I wrote a book is because this is stuff that you actually can't do on your own as one family because it's like everywhere. Um, I and so I've been working at BU since my son was 3. Since he was in 4th grade, by after I'd had like 5 years at college, it's so clear to me that it doesn't matter where you go. I have seen kids just waste 4 years and their parents' money and whatever and get nothing out of it. And I have seen kids get every single morsel out of the college experience. Like it does not matter where you go. It matters what you put into it when you get there. So since my son was in like 3rd or 4th grade, I'd been at BU for maybe 5 years. Whenever it came up, it doesn't matter where you go to college. It doesn't matter where you go to college. Like that's what our kids were getting at home. It doesn't matter where you go to college. Um, and I believed it. And just saying stuff isn't enough. Like you have to actually believe what you say. Um, and still go through the process. I remember like he gets into like Penn State, like someplace really good, and he's like, it's not good enough. I'm like, what are you talking about? It is literally a world-class university. You're 17. You knew nothing about this. Like you could get an awesome education there. Like this stuff runs so deep, you can't as a single family fight it on your own. It is it's one of the reasons that I wrote my book because I just felt like I needed to get this stuff out more broadly. Um, and like everything, it's going to be worse if you have the other stuff too. So if you were raised in poverty and or have a trauma history, this challenge dealing with college admissions, my kid went through it, he's fine. And there was some unpleasantness, but not a true mental health problem. But if you've already had adverse life events going into this phase, it's going to be way worse. That was a rather long-winded answer to your question about whether kids are too sensitive, but yeah, I think we need to do better for kids of all socioeconomic status, frankly.
So as a parent, what is your advice in terms of when do you actually seek help? Because I mean, kids have good days, they have bad days, they have anxiety, all these things happen. And like you said, failure is good. You have to learn, you have to know how to overcome things. So I guess what's your advice as a parent as to when something is just part of growing up versus when they really do need to seek help or this really is becoming a mental health issue?
Yep. So, you know your kid better than anyone. Your parental intuition is like pretty likely to be accurate. So we're in this super scientific age and people really like question things like instinct because it seems super squishy. But your instincts as a parent are like highly evolved, tens of thousands of years of human evolution. Like, your kid. I'm going to tell a funny story. It's not funny. One of my kids had acute appendicitis last year. So we're like sitting around the kitchen. So the community where I live, everything's super close together and everybody walks everywhere because you can't park. So we're sitting around the kitchen. My kid's like, my stomach hurts. Stomach aches are common, whatever. So I ask him questions and, I went to med school. So I know what kind of questions to ask when someone has a stomach ache. I asked him a couple questions. I'm like, I don't know what's going on. And then I said, what do you think about going to urgent care? And he said, well, can you drive me? And that set off my radar. I was like, oh my God, this athletic kid who walks over to this neighborhood twice a day wants to be driven a quarter mile, like something is seriously wrong. So the reason that I like this story is because I had the med school knowledge to sort of ask the right questions, but it was actually my mom's spidey sense that was like, something's wrong. He wants to be driven a quarter mile. That makes no sense for this kid. Yeah. And sure enough, urgent care, they sent us to the emergency room, same day surgery, acute appendicitis. Yeah. So the first part is, your kid and trust your intuition, particularly if you think something's wrong. A couple other general things. Have a friend who has older kids. If you have I have a sister whose kids are 10 years older, so that's perfect. But just like have a friend whose kids are like 4 or 5 years older and just ask them stuff a lot. Like, my kids are doing this. Does that seem normal? And they'll be like, oh yeah, a lot of kids do that at that age. Or they'll be like, maybe you ought to see someone. So having that person in your life is super useful. And then teachers know kids. They just do. So any concern you have, ask a teacher who knows your kid well. So I think sort of having those things in mind, it's not a decision you have to make on your own. Like, if you're not sure if your kid needs help, like, have a couple people that you trust enough that you're gonna ask them.
Yep. I totally love that advice of just know your spidey sense because I knew exactly when my kids were upset and they're saying, it's fine. You're like, oh no, it's not. I know you're not fine. You know what's going on with your own children. Okay, well, I know people are dropping questions in the chat. So if you guys do have any other questions, please feel free to drop those in the chat right now. Julie's collecting them. I do want to touch though, I know you have mentioned you have a book coming out. I think Missy will drop the link and you can talk a little bit about the book and why you wrote it and what's it about and buying it online.
Yeah. So I'm really excited about my book. I actually really love it. It is written for college-bound kids and their parents. It's honestly, I wrote it for my daughter and her friends. I coached her soccer team when she was little, and I would like be in my office all day with girls who weren't doing well. And then I'd be at the soccer field with 8-year-old girls who were awesome. And I was like, I want to do something. So these girls on my soccer field don't become the girls in my office. And that's what I tried to do. But I wrote it for parents as well because some of the material is honestly quite intense. There is quite a bit about sex that people don't usually talk about. And there are difficult topics in mental health that are for sure discussed. So I wanted it to be a book that the parents would want to read too, so that they could talk to their kids about it. Yeah, it's coming out in April. I'm super excited. I don't have a book website yet because I'm too old and need to hire a grad student. But the publisher has already put it on Amazon, and the book description came out really well. So I'm really happy with how it looked. I am really excited to engage with people about it. I would love to get book group invitations when it comes out. I'm doing a PTO event at my school this spring. It's going to be a transition to college event. Yeah, I'm just excited to share. If you do reach out to me, if you have been in the New York Times, you get a lot of emails, and not all of them are nice. So if you do reach out to me, if you could put in the subject line the RWB, so I know it's from a friendly person, and then I will for sure read it. Because yeah, I'm totally open to joining your book group by Zoom, or for a larger event, maybe coming to where you are. And I can't wait. So thank you, Julie.
No, that's great. And so if you want to give whatever email you want to share in the chat, that would be great. Hey, so if you got parents, you guys have got a group of friends going to college soon, have a book club and have Tildy come and talk to you about it. I think that sounds like a really great idea. Wish I had had that before my kids all went off to college. All right, Julie, I know you're furiously writing, so I'm going to bring you up because I think there are questions in the chat. We'll let you guys get to those.
There are indeed. And we'll start with the first one. Bullying came up quite a bit in the chat, especially because social media has been used as a mechanism to advance bullying beyond what, used to happen just at school. They have now 24/7 access to these kids. So how does bullying fit into your narrative?
Yeah. So that's part of so you're the 85% that gets you to a B. So that's part of trauma for sure. Bullying is traumatic, particularly if it's at young ages, and the developmental age around 12 is a particularly vulnerable time. Yeah. Interestingly, people who have early childhood trauma are at even higher risk for bullying. So with mental health, things have a tendency to snowball and compound. But for sure, I used a lot of sort of general terms, but yeah, for sure, bullying is part of the general term of trauma, which you could roughly call, all of the terrible things that people do to each other. Yeah, I guess I more specifically talked about earlier childhood trauma, but bullying for sure.
You talked about caffeine. What about sugar? Sugar used to be the big bad boy. So what is sugar a factor in this at all?
So I meet them when they turn 18. Yeah, I think probably right. If you're a kindergarten teacher, probably sugar is the thing you're writing home about. And if you're in the college mental health center, it's probably caffeine. Yeah, that's actually a funny comment. But for kids with behavioral problems in school, for sure, it's an important cause of symptoms that can look like ADHD. If you have a Coke at lunch, for sure, you're not sitting still in your afternoon class.
Then the other question that came up a couple of times is, how did the COVID shutdown of schools affect young children? And, now those young kids are, there's a bunch of kids that are like you are seeing now that were affected by that, as well as younger ones that are still in school right now.
Yeah. So the COVID shutdowns were an unmitigated disaster for children of all ages, full stop. But I have to say, so I have to say, like, the kids have moved on. They have mostly bounced back from the mental health side of things. I know there are other issues that I think haven't fully recovered, like learning loss, and there's a lot of disruption in schools. But yeah, kids need routines. They need to be outside every day. They need to interact with their friends. Our own son was in fourth grade in the shutdown, and he was just old enough to sort of know what he was missing. And he just one day was just crying to me and my husband and saying, why aren't you letting me see any of my friends? It was terrible. Yeah, COVID was absolutely devastating for kids of all ages. It was the hardest 2 years of my professional life. It was terrible for college students. We're social animals. We're meant to be out in the world doing stuff. And again, kids have mostly bounced back. But it was a long ride.
So currently, kids are seeing either live or online or on television the issue of citizenship and, people being literally snatched off of streets everywhere. I mean, it's happening literally everywhere. So how is that affecting young people?
Yeah, so this is one of the questions that Julie didn't get to because of time, like who are the vulnerable groups? Yeah, this is, well, I mean, how you would categorize it would be like, this is a trauma. Like if a loved one is removed from your home, this is a trauma. It is the mental health consequences of something like this happening in your family is terrible. And the people who are going to be most vulnerable to having mental health consequences of all of this stuff are people who are already marginalized and already have numerous other risk factors for mental health problems. And then there's going to be no Medicaid, so the problems just snowball and snowball and snowball. Yes, I think I said social media is not one of the things that keeps me up at night. This is one of the things that keeps me up at night. Absolutely.
So someone said about, studies that well-to-do families, their kids have an anxiety epidemic, which is um, so, and they ask about a difference between, the kids in poverty that you talked about. Is the difference the ability for access to care? So, seemingly, and in theory, a more well-to-do family would have access to healthcare, community services, all kinds of different things, where a child that doesn't have that, you know, but we still are seeing, but basically they're saying that they're still, even with folks who are well-to-do or middle-class children, there's an anxiety epidemic with them. So what do you think about that?
Yeah. So Abigail Schreier was actually really good on this. Her book got quite a bit of attention for a while and it had some problems, but one of the things that she was really good at was like defining the terms and like being specific about who she's talking about. And her whole thing is like, there are kids who are under-resourced, underdiagnosed, undertreated, and then there are kids who are sufficiently resourced, overdiagnosed, and overtreated. So one framing thing to say is that like most kids are completely fine. So take that home, please. But there are a lot of anxiety disorder diagnoses out there right now. And I think to me, they cluster around a few things. The way college pressure is, you cannot be anything less than perfect, or you will not get into the college of your choosing, apparently. I'm not kidding about the energy drinks. A lot of what looks like anxiety disorders is way too much caffeine. I know what happens to me if I go to Starbucks and get something that is bigger than their smallest size. If you're going every day, it's really easy to have a totally chemically induced anxiety disorder. Marijuana also, people think it makes them less anxious, but chronic use often elevates their anxiety. So there are a whole lot of things at play. And also a whole lot of anxiety is normal. So, I do think there's been some diagnosis creep, and that some people who in our generation wouldn't have been diagnosed are now diagnosed. Which is fine. I think our generation, I think we were probably undertreated. So
Well, is anxiety a protective, is that supposed to be a protective factor that has now gone? This is not a question that anybody else asked. It just prompted it when you said that. Is that supposed to be, do we have this because it's supposed to protect us from something versus it being just always, it's always a problem?
right. So anxiety makes you do stuff. So we're supposed to have it. The right amount isn't zero anxiety. So I often say to students, like, so anxiety makes you do good things like pay your bills on time, work on that term paper 3 weeks before it's due, call your mom back. And maybe 1,000 years ago, anxiety made you like double check that you had enough seeds that you could plant in the springs. Maybe you shouldn't use all of them up at your harvest. So anxiety makes you do stuff. When anxiety gets worse is like when you don't do the thing that the anxiety wants you to do. So if you're a college student and you're sitting around worrying about your final, the worrying is saying, hey, go do this thing. And it's actually giving you a little bit of energy to go do that thing. But if you don't go do that thing, you still got the final. So, anxiety is something that sometimes the right thing to do is to ignore it. But often the right thing to do is to be like, why am I having this feeling? Oh yeah, my rent's going to be late. If I don't do that, better go do that today. So to some degree, there's like a maturation process of sort of learning when to tune into your emotions and when not to, because some emotions are sort of not that relevant to modern life and like not super helpful. So yeah, so to some degree, anxiety is part of normal maturation. Never mind, like anyone has anxiety when they're in a new situation, and the way our world is, there's just tons of change and all of that stuff. So, and there's nothing wrong with going to treatment for anxiety. That's just an emotion. Most people are gonna mature out of it to a significant degree.
So, what about abuse? Someone asked. Now, abuse is a trauma, correct?
Correct.
So, and then someone said, how bad does something have to be considered a trauma? So I know that's two different questions,
Yeah.
kind of, but sort of not.
Yeah. So, for trauma to have, so trauma happens all the time. There are big traumas, there are small traumas, like a motor vehicle accident, that's pretty common, that's a trauma. So when trauma is bad, when trauma is going to have the worst mental health consequences is if it happens at a young age, if it happens repeatedly, and if it's perpetrated by a caregiver or someone very well known. In other words, if it's perpetrated by someone the individual is supposed to trust. So with very small children, as far as we can tell in terms of downstream consequences, with very small children, neglect is just as bad as breaking their leg. In terms of the psychological consequences downstream. So there's no sort of dividing line exactly. There's more sort of a continuum. But the things that make the news, I don't know, hurricane goes through the town and so-and-so's house was torn down. So that's terrible. It's a trauma, but it's a one-time thing. And assuming there are resources to rebuild and move on, that family is likely to be, to fully recover. But a trauma that occurs early in life and is repeated, is going to be way worse. So this is one of the reasons it's so important to identify things like, say, sexual abuse. It's so important to identify it because one episode is obviously bad, but it's the recurring pattern and the over and over again that is psychologically devastating. So you want to sort of be intervening as early as you can. Not a perfect answer.
Well, no, but I mean, it is what it is. Trauma is, I think it affects all of us. Someone asked about losing a parent at a preteen age. My family, I was 19, my sister was 16, my brother was 14, and my youngest sibling was newborn when we lost our mom. And so, yes, somebody else wrote underneath it, that's absolutely trauma, which it was, but it affected us each differently because of where we were in the stages of life. So do you concur that it's going to affect a child depending on what age they are?
100%. Yes. Losing a parent is obviously bad at any age, but their ages, after a certain age, it's sort of normal to lose a parent. But yes, losing a parent before the age of 15 is really, really devastating. For you, sounds like it was very challenging in a totally different way than probably
She
for
was a
your
single parent, so absolutely.
Yeah.
Yeah.
But yes, right. And death, loss, death can be a trauma or it can be a normal emotion, depending on the situation. Losing an elderly grandparent, you might be very, very sad, but grieve and move on, normal emotion. But death of someone, a young person, death of a parent, can be a trauma, particularly if you're there, or if I've met kids who found their deceased father on the couch. Teenage, that is a trauma for sure. Yeah.
Well, I want to end on positive note, and I noticed we've gone a little over time. What gives you hope? Someone wanted to know what gives you hope in your practice right now.
Oh my gosh. So everything, honestly, right now, you guys are giving me hope. I love your whole organization. And honestly, just a dose of, I know not everyone here is a mom, but just a dose of moms gives me hope because the amount that moms do to improve the world for usually mostly the people close to them, but also people in the community more broadly. So working with young people is totally awesome. I mean, they say the funniest things. But I work with people who have big ideas and they're going to solve problems. They're going to create green energy. They're going to they have all of these big dreams and they have so much energy. And they all are going to go out in the world and do great, great things. So for sure, my work is really mostly uplifting. It has its moments for sure, but most people who come in and see me get better, or at least learn to live well with what they have. Yeah, meaningful work, I think, is sort of the punchline for the thing that is good for midlife adults to maintain hope. If you feel like you're contributing, what you're doing is meaningful. I think that's pretty good.
Julie, I'm going to kick it back to you.
Okay. Well, I want to thank Tilly so much for coming and sharing her knowledge. I think her book sounds amazing. Like I said, I wish I had it several years ago when I had kids heading off to college. Thank you all for joining us tonight, and hope to see you soon. We have so much going on this week and next week, so please come back. We would love to see you again soon. All right. Good night, everybody.
Night.